The only way to show compassion is to have that going on in ourselves. Didi Amakakoka. I also go by Didi. I am the medical director of East Lake Clinic. With the pandemic and then the unrest and fallout of George Floyd has really spearheaded this idea of, can we build a clinic that is trauma healing?
Everybody deserves to be incredibly seen, heard, cared for, and I will even say, feel loved when they're receiving health care. My name's Maria Kafer. I'm a family doctor.
Working in a healthcare setting can be very stressful, and so to be surrounded by staff that are striving to understand how that can impact ourselves and our work will help minimize the trauma.
Me llamo Jeannie Gambucci. Soy una médica de medicina familiar en la Clínica de East Lake en Minneapolis.
Our first jaunt was to actually talk to the community, where we asked the community, what makes them healed. We also did a group with the staff here at East Lake, where we did a mixture of teaching about trauma and teaching about trauma-informed care, and then envisioning sessions on what helps them stay grounded and healed. We also had a third wheel, which were community members that were already involved with trauma healing, and then they envisioned ideas that they had for healing. We put this all together and came up with a roadmap.
In programs, you might be focusing more on the patients or more on staff, but the understanding with trauma healing is that it's so important for everybody to be involved in the healing work.
It allows us to be able to open up, connect with one another, show up for one another, and be in community, and not just for patients, but creating a culture here that feels safe for everyone.
They're organizations that are trauma organized, so they're reactive, they're hierarchical, they're kind of constricted. If you infuse that with the values of trauma-informed care, that's been a lot of what we've been focusing on for the last 4 years.
It's an attitude or a general approach. When staff learn about this approach, it can be something that is applied to interactions between staff members, and it can also be applied to direct patient care.
Close your eyes, take some deep breaths, inhaling in and out, letting off some of the stress of the week, bringing in energy for another day of working together to make this a healing place.
With the trauma-informed care program, we have a daily huddle. Any staff or patient harm is addressed specifically, as well as any learning tools about how to cope with trauma or stress.
Good.
They are really life lessons that can even be applied outside of the workplace.
East Lake Clinic itself and their providers are very deep-rooted and organized on changing the way that we see our patients.
We are all completely equal, no matter what type of provider we are. Whether it's doctor or nurse practitioner or physician's assistant, nurse, medical assistant, front desk, lab, x-ray techs, all as healers in their own right, because every single interaction with somebody either reinforces that they're seen and believed, and that their strengths are reflected back.
Like a whole package for the patient per se, trying to make sure that they're stable in all the senses, mental health, emotionally, and economically.
So what is trauma-informed care? It is literally looking with a new eye, culture, framework, how to do care.
Thought of it as at least a 10-year project, is to completely transform the culture of our clinic and then hopefully our organization ultimately, so that all of these values are infused in every single thing that we do.
Then when you walk into that, that is a change of culture.